Hello and welcome to the Advanced Rayid Iridology course. Here we are going to perform a live Rayid Iridology session. So this is our sample that we're going to be looking at today. So be sure to take note of any markings that may be evident and apply to both eyes, both irids here. And then we're going to go ahead and take a look and magnify one eye at a time as we do the assessment. So let's go ahead and get started. We have a sample of a mixed genetic with the female in their late 30s. We will go ahead and get started on the left eye. So refer to the chart and we will illustrate the iridology assessment first starting with the major iris signs. Okay, we can look at the constitutional type first. This is considered a medium constitution with an open space, the semi-even iris fibers. Let's take a look at the potential hydrogens. We can see that it looks fairly healthy. The potential hydrogens of the body, we can see some underactivity with chronic tissue. There's some raised whiteness indicating cellular activity that is low, as well as a weakened tissue vitality, which is perhaps in a prolonged state. The white indicates an acute condition of inflammation and weak cellular activity that might be used at a high rate, which perhaps may indicate some pain with the inflammation. Perhaps you can see some joint pain. Now, we don't want to diagnose, so you can ask the client, unless you have a medical license, if they have any joint pain, and likely they will indicate arthritic activity that may be evident. But when we see that there's some joint pain, we may often look at if there's a poor blood and nerve supply. So if we look at the scurf rim, or we can look at the venous congestion to see if that is evident, we will also see, which is likely genetic, that there is some weak blood and nerve supply that is also not getting to the rest of the body tissue. So that's why the arcus senilis, you can see the arcs within the iris. There's some rigidity, there's some muscle cramping, muscle and tissue cramping, which is also impeding the blood and nutrient supply to the rest of the tissue. And again, this is likely a genetic issue because it does appear chronic. And because we're looking at the left eye, it may also be evident in the maternal side. Unless it is evident in both eyes, then it might likely be genetic on both sides. And because this individual appears to have some correct living habits and principles, they may not be absorbing their nutrients. So there is an assimilation ring. You can see within the small intestine some weak absorption. When you look within the zone of where this is evident, that looks like uric acid, and you can see the assimilation ring that is evident right where the small intestine is also located. There is an absence of radii solaris, so fortunately there is nothing leaking within the gut, and there's no sore spots present either. So let's go ahead and explore the internal organs. We can take a look at the solar plexus and see in the zone between 3 and 4 o'clock. There is maybe some issues with the solar plexus. This particular individual has had some stress and some injuries in that area, particularly related to birth trauma. And then in zone 11 to 12, close to 12 o'clock, we can also see a small lesion in the psychological sector, which could also indicate internal injuries, which I believe is the case with this individual as well. All right, we can look at the adrenal glands, and if there's not anything present where the adrenal is located, then we can also take a look at the pupil. So the adrenal is just above the kidney, and the adrenal glands look like they may be semi-depleted, which may indicate an overexertion or stress, perhaps a caffeine stimulant, or the individual may, again, feel like they need a little bit more rest and recovery. Looking again at the venous congestion, we can see, we want to look at the heart and see if we can find any issues. And there is a little bit of tissue again, there's some lesions within the tissue area of the heart, again, close to the solar plexus, which may also suggest poor blood and nerve supply within the heart region and near the solar plexus. And within the venous congestion, we can see evident just some slight subacute lymphatic congestion in this iris as well. So what's recommended for this individual is perhaps taking foods that are easy digestible, helping to get a little bit more massage therapy, eliminating whatever is causing some stress. Maybe on a genetic level, there's some tension, muscular tension or hypertension, and helping this individual not only get the best nutrients, but enough exercise and enough recovery to regenerate these cells. But likely this individual is doing the best they can, because you can see there's not a lot of chronic problems that look like are acquired, but more genetic related. Okay, so we're going to go ahead and just move on to some of the anatomical locations here. And just make sure we mark anything that's fair, good, or poor, and document any other markings or signs that we might see. So with the digestive system, we're going to say it's not absent of any problems, but we would probably mark that as fair and definitely room for improvement there. We want to look at any anatomical locations that are only going to be found in the left eye. So anything that's on the left side of the body is what we're going to see in the left eye, and anything that's going to be found on the right side of the body is going to be found in the right eye. And color shows up the same color in the iris as it does the body. So we brought up uric acid that's found in this eye. We see with the yellow coloration there. So, and that's showing up kind of in your digestive area. And it's showing up right where there is a poor assimilation in the pupil. So if you're to look at the zones, we're looking at it between 8 o'clock and 1 o'clock approximately. And because we are also addressing holistic iridology, we want to take note of anything that could also be addressed on the emotional or psychological level. When we're seeing weak assimilation, that may be an individual who has some block around receiving nutrients or anything that's good to improve the vitality of the body. Digestive related matters could also be taking a difficult time swallowing or digesting events, or even perhaps trauma in their life as well, to improve their digestive conditions. Okay, so there are markings down here. This is right toward the lower back and bladder area, as we're mentioning anything that's related to the uric acid between 6 and 7 o'clock. So we want to take note of that. You can see some bladder weakness. And then when it comes to the colon, we've pointed out some of the areas that have affected the heart, solar plexus. That's also where the descending colon is. So you can see wherever it's occurring in the body as far as the colon, if it's going to be any kind of markings or weaknesses in those areas, it's going to be adjacent to the same area of the body. So descending colon, there's a few closed lesions there, and maybe even some small bowel pockets showing up in the autonomic nervous system in the colon area. Okay, and then we also have a little bit of marking in the ovary area here. And this is the abdominal wall and groin area here, where we can see some breakages in the tissue there as well. And also right here in between zone 1 and 2, we see some, looks like some tears or something. It looks like it's the neck and shoulder area here, and breakages in the skin. So I would consider this being maybe some kind of injury, tissue injury here. So you want to talk to the client and, you know, ask any kind of health related questions, which appear to be in a prolonged chronic state. Okay. Okay, so, and just also make note of a little bit of lymphatic weakness too, that's showing up in its chronic and subacute chronic stages. And remember, the lymphatic rosary is often genetic, closer to a blue eye, having more of a difficult time even digesting lactose. So often we may see others with lymphatic rosary as a lactose intolerant type because they're having a difficult time excreting toxins through their lymph nodes, and they may be more prone to congestion in their body. So massage therapy, any way to generate heat within the tissue cells to evacuate through their mucous membranes will be healthier and recommended. Okay, we're going to go ahead and move on to the right eye. Markings of note that are also applicable to the left eye. We see the same thing, the assimilation ring, the uric acid. We also see another marking in the brain area. It's a little bit more pronounced here on the right side. We're going to pull up the grid, the overlay, so that we can identify that. Okay, one thing I did want to point out is the neurovascular cramping that was a little bit more evident before we put the overlay on. There is some markings of the neurovascular cramping. Restriction of blood and nerve supplies to the tissue, again, that could be causing inflammation in the joints. Okay, so it looks like this eye does mirror the other iris. So there's a lot of similarities in the anatomical locations and different weaknesses that are evident. So we did point out a little bit of the colon in the other eye, but with this one, we're seeing it more evident in the small intestine here. If you want to refer to your chart there, that's going to be between 2 and 4 o'clock. And it's within the collarette, just inside the autonomic nerve wreath. Again, just some darker markings there that we've also discussed in the left eye. And then if we travel down to the extremities, we can see in the leg, maybe there is the right extremity, we can see some poor blood and circulation, perhaps in the foot area. And again, if this individual is encountering some joint pain, they may notice that there's poor blood and nerve supply to their extremity. And just adjacent to that, there may be also an indicator of some kidney weakness. And because we have already confirmed that with some bladder weakness, we know both the bladder and kidney are correlated. So there may be some obvious markings since they are related. Okay, and so here is a marking here in the vaginal area, maybe some uterus and vaginal weakness there, and a little bit of maybe some spinal, lack of spinal circulatory support there as well. Okay, and then we're just going to go ahead and make sure, because we are on the right eye, that we always look at the liver, gallbladder, and pancreas area. We do see something here in the gallbladder duodenum area. The liver seems to be looking okay, but we would definitely make some notable weaknesses here near the gallbladder. And then where there is a little bit of tissue inflammation is also kind of where some of the bronchioles appear as well. Okay, now we're going to go ahead and wrap up with the Rayid iris type. And taking a look at the iris fibers, you can see that there are some wavy uniform fiber structures with subtle variations. And this indicates a stream shaker type, a combination type, which is also referred to as the kinesthetic extremist combination. And then we can also see some of these nerve rings, which are the ring of achievement in Rayid, and also a little bit of the venous congestion here, which is referred to as the ring of purpose in the Rayid model, with the slight rosary, which can also indicate a ring of harmony or peacemaker personality type. Okay, and that concludes our live iridology analysis for our advanced Rayid Iridology course. And then go ahead and complete your iridology performance on the iridology samples provided. Best of luck and thanks for joining us.